Health experts have voiced deep concern over the escalating prevalence of non-communicable diseases in Uganda, citing factors such as increased alcohol consumption, unhealthy diets rich in oils and sugary drinks, tobacco use, and physical inactivity. The issue was highlighted during the launch of the DI-CARD project aimed at combating NCDs like diabetes, cardiovascular diseases held at Kamchila Health Center 4 in Kabale municipality. Dr. Frank Mugabe, Principal Medical Officer in the Ministry of Health Department of Non-Communicable Diseases, revealed alarming statistics indicating that diabetes cases in Uganda have more than doubled over the past decade. He stressed that among every 10 Ugandans screened, at least 3 are found to have hypertension, which can lead to severe complications including heart failure, kidney disease and stroke, resulting in significant health costs.
Diabetes has more than doubled in the last 10 years. Much as the burden of hypertension may have remained stagnant, but it's also very high. Out of every 10 people, almost 3 have hypertension. And out of every 100 people, about 5 have diabetes. But you know, these are chronic diseases. Once you get down with them, it means it's forever. You have to be on medication, you have to be spending money, you have to be going to hospitals, and they lead to other serious complications.
Dr. Mugabe attributed the rise in NCDs to widespread adoption of unhealthy lifestyles, including poor dietary choices, lack of exercise, and excessive alcohol and tobacco consumption. He urged the public to prioritize regular health screenings to monitor their health status and take preventive measures.
It's important that we emphasize prevention, early screening, and early treatment so that we are able to stop these conditions. For Kabale, I've particularly highlighted the issue of alcoholism. There is too much alcoholism, all sorts of alcohol. We need to reduce alcoholism. I've also highlighted the issue of unhealthy diets. People have moved away from eating vegetables, the dodos, the bishusha that we used to eat. They have moved to more of eating oily and fried foods and sugary drinks, which are quite dangerous.
Dr. Olalo Charles, Director of Clinical Services at the Ministry of Health, emphasized the global and national threat posed by NCDs, noting a substantial increase in diabetes prevalence globally from 1.7% to 8.5% among adults since 1980. He underscored the urgent need for effective interventions to curb this trend, given the rapid changes in lifestyle contributing to the rise in NCDs.
As we gather to launch the diabetes and the cardiovascular diseases, that is the DI-CARD project, near Trinidad project. Non-communicable diseases are now a global and national public health threat. The prevalence and mortality due to non-communicable diseases has persistently continued to increase, not only in Uganda, but globally. Globally, the prevalence of diabetes has nearly doubled since 1980, rising from 4.7% to 8.5% in the adult population.
Dr. Gilbert Mateka, Kabale District Health Officer, welcomed the DI-CARD project as a critical initiative to enhance the district's capacity in managing NCDs. He reported a significant weekly influx of new cases of diabetes and hypertension in the district and emphasized ongoing community health education efforts aimed at reducing NCD risk factors.
This is a very good project that is coming to support the health facilities in both prevention, screening, and treatment of these patients. We want to make sure that all our patients that come through are given good services, but also reach out to the communities to see how best to educate the communities to be able to prevent the increasing burden of non-communicable diseases. So this project is most welcome in Kabale. We are very excited that we are among the few districts that were selected in the country, and we pledge our commitment and support as health workers to make sure that it is successful, especially in benefiting our patients.
Andrew Nogoli, project manager for the Global Livingstone Institute, highlighted the significance of the DI project, noting its implication in Ghana and Uganda as a pilot study. He indicated the project potential for expansion to other districts based on its outcomes, supported by $1.36 million investment from partners including the World Health Organization and the World Diabetes Federation in collaboration with Kabale District local government.
Project they chose Uganda and Ghana just because we have showed strides in fighting NCDs globally, but we have not had enough financial support. So this support has really come to strengthen our existing systems to implement this project in Uganda. We also chose Kabale and other districts just because of the continuous ongoing work that has been done as part of strengthening the systems. So we believe this is a pilot in the first 4 districts. Depending on how we perform, there's a possibility of this program expanding in other parts of the country.
The 4-year DI card project aims to booster efforts against NCDs in Uganda, focusing on enhancing healthcare services and community education to mitigate the growing burden of these chronic diseases. Compiled by Norbert Njamhachi for Kigezi Television.